Bace Study Journal by Chloe Rodriguez. ELISA, a laboratory test that is used to detect and measure specific substances like antibodies, antigens, and hormones. My misconception was distinguishing the difference between direct ELISA and indirect ELISA. How I corrected my misunderstanding was watching a YouTube video called 4 Types of ELISA by Lucas Learns and took some notes while watching the video. Direct ELISA uses only one type of antibody, while indirect ELISA uses primary and secondary antibodies. Indirect ELISA has a better advantage because it uses secondary antibodies. Protein structure, the amino acid sequence of its polypeptide chain. My misconception was I was wondering how each protein has a different structure. And how I corrected my misunderstanding was I did some research and found out that different structures occur because of the unique sequence of amino acids. The different structures are primary, secondary, tertiary structure, and quaternary structure. Clinical trials. Clinical trials is a research study that involves human volunteers to test new treatments, drugs, medical devices, or other interventions. My misconception was I struggled remembering the different phases. How I corrected my misunderstanding was I used the quizzes that Mr. Sharp had created. Phase 1 contains 20 to 100 healthy volunteers or people with the disease and primarily focus on the safety of the drug. Phase 2 is 100 to 500 volunteers who have the disease, and the primary focus is the efficiency in determining the side effects. Phase 3 is 500 to 1,000 volunteers who have the disease, and the primary focus is to monitor the drug's efficiency and the side effects. Signage. Signage is the signs or symbols to communicate a message, and my misconception was I struggled with the 4 different biosafety signages. How I corrected my misunderstanding was I searched up the 4 different biosafety signages and took notes. BSL 1 is the lowest level for work with low-risk microbes that are not generally associated with the disease in healthy people. BSL 2 is the agents associated with human disease that pose a moderate health hazard. BSL 3 is for work with microbes that can cause serious or potentially lethal disease through inhalation, and BSL 4 is the highest level for work with highly dangerous and exotic microbes that pose a high risk of aerosol-transmitted laboratory infections and life-threatening disease. Sterilizing versus disinfecting. My misconception was I struggled with the difference between sterilizing and disinfecting, but how I corrected my misunderstanding was I researched the topic and found out that sterilizing eliminates all microorganisms, while disinfecting eliminates most pathogens but not all.